I wanted to be a voice for people like myself who are young men of color, young gay men of color. I'm 24 and I live in the city and I am around people like myself in that category, and I wanted that voice of that population to be at the table and have a say in the way we are spoken to, in the way that our bodies are spoken about, in a way that our health is spoken about. And I wanted to be more than just an advocate. I wanted to be a voice for those of us who feel like, maybe the Department of Health hasn't heard our side of it before.
I got involved because HIV impacts my community, and it's an issue that I care about. And instead of kind of like sitting on the sidelines and complaining, I wanted to be able to do something about it.
I come from many, many communities. I'm HIV positive, I'm African American, I'm a man who love other men, and it was affecting me on many levels, and I wanted my voice to be heard. I wanted to be a part of the process. I needed to be at the table. I needed to get the information so I can bring it back to my various communities.
I hope to be the voice for trans women of color, for trans people of color, a population that's been severely impacted by HIV, and that we continually sit at the table and that we continually have a voice, that we can be part of the process.
I got involved with the HPG because I have a voice and I have a lot to say when it comes to HIV prevention. And I know that the HPG would give me the opportunity to say the things that I would like to say about HIV prevention without criticizing my thoughts, and also working with other like-minded individuals about HIV prevention.
Everybody's impacted. This is New York City. Everyone lives in a community, knows someone, works with someone, has a family member, is somehow connected to HIV, whether they want to acknowledge it or not. And we need those voices at the table, because my opinion on what is needed for young Black gay men who live in Washington Heights might be interesting, but probably not accurate. So we need those young men at the table speaking their truth, sharing their experiences, giving their input, and really informing the process. We
represent the humanizing aspect of HIV prevention and treatment. You can hear 50,000 new infections or the amount of a year in the US, or you can hear the amount of infections in New York, and that may not mean anything, but because we're a diverse body that is ethnically, racially, class, gender, sexuality diverse, we're also diverse in our passions and the groups that we advocate for. So it's a way of humanizing the epidemic and making sure that we're responding to it by including, a round table of everyone who has a personal stake in the epidemic.
The most effective HIV prevention programming I've been involved in has been when I've worked directly with, for example, the ballroom community in implementing testing and outreach services at ballroom events. By having a community board involved in the planning process, we were able to invite the right people and reach a much broader audience for the services that we were providing.
I realized that it was definitely important to be at the table, because that's the only way that you can really represent your community and reach it on a broader level than just inside of your agency.
I think being a woman of color, I know that a lot of the peers I have, a lot of the friends I have, often are standoffish when it comes to research or, medicine or policy, particularly around epidemics like HIV. And I think that part of it is because of the historical experiences they've had. And so when you have an opportunity like the HPG, that affords you a voice and it affords you collaboration with people in different fields, you take it, you jump on that opportunity so that you're heard.
For more information about the New York City HIV Planning Group, you can contact us by phone or by email, follow us on Twitter, like us on Facebook, or watch us on YouTube. Please subscribe. We hope to see you soon.